Is traumatic grief related to moral injury? Have you ever wondered how the loss of a loved one can intertwine with feelings of guilt or shame? This brings us to the concepts of traumatic grief and moral injury. While they are distinct, they can overlap, especially in the context of trauma and post-traumatic stress disorder. Let's start with traumatic grief. This term describes intense and prolonged grief reactions that happen after losing someone close, particularly in sudden or violent circumstances. People experiencing traumatic grief often feel persistent yearning and emotional pain. They may struggle to accept the death, which complicates their recovery and can lead to symptoms of post-traumatic stress disorder. Now, what about moral injury? This is a trauma-related syndrome that occurs when someone faces a violation of their deeply held moral beliefs. This can happen through actions they take, things they witness, or even when they fail to prevent harm. Core feelings associated with moral injury include shame, guilt, and a loss of trust. It can also lead to depression, anxiety, and social alienation. So, how do these two concepts connect? The relationship between traumatic grief and moral injury often arises when the grief involves situations that challenge moral beliefs. For instance, if someone loses a loved one due to violence or betrayal, they may experience both traumatic grief and moral injury. The grief can be compounded by feelings of guilt or shame related to the circumstances of the death. Both traumatic grief and moral injury can occur alongside post-traumatic stress disorder. They share symptoms like guilt and shame, but post-traumatic stress disorder also includes additional symptoms such as hyperarousal and fear-based reactions. Interestingly, moral injury can exist without post-traumatic stress disorder, but it often makes the symptoms of post-traumatic stress disorder worse. In summary, traumatic grief can indeed relate to moral injury, especially when the loss is tied to morally injurious events. This overlap can heighten psychological distress and complicate recovery. It's crucial to address both aspects in trauma-informed care and treatment for post-traumatic stress disorder. Understanding these connections can help in navigating the complex emotions that arise from loss and trauma. If you or someone you know is struggling with these feelings, consulting a healthcare professional can provide valuable support and guidance.